I'd like to talk a little bit about healthcare. I'm very pleased to see that the president's budget includes policy that I've sort of worked on for the past few years to end some of the gaming of the generic drug application process and bring less costly, effective medications to the market sooner. If anything, my understanding is that the proposal goes a step further in the president's budget and uses commercial marketing rather than just filing as a time trigger. The blocking act that I've proposed has a slightly different mechanism. What concerns does the administration have right now around generic drug applications, filing and marketing, and all the timelines?
Congressman, I think the president would likely tell you that we want to make sure that generic drugs, safe and effective generic drugs, are made available as quickly as possible to the American people. We know that within that sphere of the manufacturing industry for drugs, lots goes on. I can tell you about this as the former Attorney General in California, how we try to make this a more competitive marketplace and how we try to stop the gaming of deals that are done behind closed doors that limit accessibility to safe and effective generic drugs. The president has charged us to do everything possible to try to make the drug industry a more competitive place. That would mean that we'd be able to put generic drugs out into the public's hands more quickly.
Totally agree, totally agree. We've also been working on a Biosim Act to encourage providers to use more of the biosimilars like they do in Europe and reduce drug costs. So we're totally in sync, I think. Switching gears to mental health, youth mental health in particular, how are the increases in the critical SAMHSA programs proposed in the president's budget going to help address the mental health needs of our kids out there?
Congressman, hopefully working with you and folks in your communities, what we'll do is we'll concentrate some of those resources that I hope you're able to get to us to help children, whether in school, through community settings, so they can access that mental health coverage or service a lot faster. We find that still too many families don't have good mental health coverage in their health insurance plans. We're trying to change that as well to make sure that no one is denied health care simply because it's a mental health condition versus a more generalized physical health condition. But we'll work with you because if we get the resources that the president has asked for, game-changing level of resources, we should be able to go into your communities and communities throughout this country and really make a difference in the lives of so many young people.
Well, I hear so much, certainly post-pandemic and even a little pre-pandemic about, some of the travails of young America, dealing with lack of social interaction in the traditional school environment. Some of the problems that are at home became exacerbated as a result of the COVID epidemic and, the lack of counselors and whatever that are out there for these children to seek. Like we had when I was a youngster, we actually had counselors in the schools, every school. It's been very different. Kind of leads me into the last question on provider workforce. Just got off a call a few moments ago with our hospital association. I've talked with our nursing providers. I mean, it's in turmoil. The lack of workforce is legendary now post-COVID. Well, not quite post-COVID yet. We're still in COVID. I totally agree with that.
That's right.
What is HHS doing to evaluate current flexibilities and programs during the COVID-19 pandemic to help get healthcare workers, CNAs, whatever, to the workforce quicker and on a more permanent basis?
Congressman, you hit it right on the nail. We're losing nurses. We're having facilities fight for health professionals, and they're paying major dollars to have these traveling health professionals come to their facilities. It's a difficult situation. We just recently, a couple months ago, put out a grant proposal of about $103 million to help with facilities that are trying to help their workforce cope. So whether it is facing burnout, whether it is those who are trying to get trained up so they can move up a notch, or whether it's simply giving that workforce a little bit more time to rest, that money we've made available so that providers could actually reward their workforce for everything they've done during COVID. And it's not enough, obviously, but it's something to try to help deal with the burnout that we're seeing in the industry.
Very good, very good. Look forward to working with you. Thank you very much.
Absolutely. Thank you.
I yield back, Madam Chair.